Good morning, good afternoon, good evening, everyone. You're welcome to today's episode of Public Health in Real Life, a channel where we hope to celebrate unsung heroes, highlight key global health issues, and inspire the next generation of global health practitioners. Today, we'll be talking about challenges faced by women in science. Historically, many scholars and then people in science have noted that women in science, technology, engineering, and maths have been predominantly underrepresented in that field. Despite making gains in the last decades, countries like America that have even witnessed significant gains still report that only 26% of people who work in STEM are women, and they tend to earn 86.1% to the dollar when you compare with their male colleagues. I would like to welcome my co-host on today's episode. Welcome, Ashwin.
Hello, Maimuna, uh, and welcome to everyone to today's episode on public health in real life. As Maimuna has alluded, um, we today's episode is about challenges faced by women scientists globally, even though there has been a significant increase in the women workforce in STEM fields globally, they still are a minority when it comes to various aspects of career progression and career growth, opportunities such as full professorship, and when it comes to recognition in the science field. Today, we will be talking to two award winning scientists, and I will turn to Dr. Maimuna to introduce our first guest, and will be back to me.
Thank you, Ashwin. So our first guest for today is Dr. Asha Wijenuga, oh, sorry, Wijegunawardana, who is a senior faculty and principal investigator from the Department of Bioprocess Technology at Rajarata University in Sri Lanka. She has over 15 years of experience in scientific research in vector-borne disease control, investigator-driven grant writing, and academic leadership. She's an award-winning scientist who received the Hiran Tilekaratne, apologies for my pronunciation, Research Fund Award for outstanding postgraduate research from the University Grant Commission in Sri Lanka, and this was in 2012. She has worked and trained at a range and diverse set of laboratory facilities, from government settings in Sri Lanka to large, well-established international organizations in Australia, Brazil, and Thailand. She has won so many awards, as we mentioned earlier, and then she also specializes in TDR research, which is a special program for research and training in tropical diseases, and which is co-sponsored by the United Nations Children's Fund, UNICEF, the United Nations Development Program, the World Bank, the World Health Organization. And she was also a finalist, not to fail to mention, at the Global Career Impact Contest in 2020. Welcome, Dr. Asha.
Thank you, Memuna and Dr. Ashwin, for my introduction. And
Thank you. Thank you so much, Dr. Asha. And our next guest is Dr. Trisasi Lestari. Dr. Trisasi Lestari is based in Indonesia. She's a medical doctor with specific training and expertise in epidemiology, hospital management, and implementation research. She has gained knowledge and skills in implementation research through several research fellowship programs organized by WHO TDR and the Alliance for Health Policy and Systems Research. Dr. Lestari is a TDR global focal point for Asia. Dr. Lestari has more than 10 years of research and teaching experience. Her research mainly focuses on health policy, healthcare improvement of quality, particularly related to tuberculosis control. As a PhD candidate at Menzies School of Health Research at Charles Darwin University, she uses existing implementation research frameworks to improve tuberculosis contact screening and Management in Papua. Papua is a place in Indonesia which houses one of the world's largest indigenous populations. In addition, she has collaborated with local stakeholders, national and international institutions, and researchers, bringing about substantial improvement in study sites and produced policy briefs and peer-reviewed publications. Her early publications were related with unreported caseloads of tuberculosis in 120 public and private hospitals in Indonesia, particularly childhood tuberculosis. This study was then followed with a study to explore how general practitioners managed TB cases in their private clinics. And focus on childhood tuberculosis has been continued in a PhD study, which is focusing on strengthening health system to improve tuberculosis contact investigation and preventive treatment in Papua, Indonesia. Her study provides evidence that tuberculosis contact investigation and preventive treatment for child contacts can be implemented in remote areas such as Papua. We are truly excited and thrilled today to talk to both of these preeminent scientists from Sri Lanka and Indonesia. Welcome first to the program, Dr. Lestari.
Thank you so much, Dr. Ashwin, for a very nice introduction, and thank you for having me here.
Absolutely. So we would like to begin the program into before we move on to the challenges faced today by women scientists, we would like to start the program off by asking you, what got you passionate about science and STEM career? And maybe we will just begin with that question. First, you, Dr. Asha.
I began my career as an agriculture biologist, and the field of biological science is always attracted me, and because it has number of specialties which I can follow, so I chose specialization in application of molecular biology tools in vector-borne disease control later on for my postgraduate studies. So this helped me to choose profession that I undoubtedly enjoy for the rest of my life. So at the moment, I'm working as an academic member of the Department of Bioprocess Technology, Faculty of Technology at Rajarata University of Sri Lanka to advance my professional skills while engaging with controlling vector-borne diseases in Sri Lanka. So I am mainly working with the neglected tropical diseases, especially controlling vectors transmitting lymphatic filariasis parasite, leishmanial parasite, malaria parasite, and as well as controlling the vectors responsible for transmission of dengue, chikungunya, and West Nile virus. So this is my main research area where I engage both laboratory and fieldwork as well in these aspects.
Thank you, Dr. Asha, for that. Dr. Lestari, let me turn to you. What got you passionate about science, and how did you the career that you got right now?
Yeah. So by profession, I was a medical physician back in 2005, and I was a general physician. So there is a limitation on what I can provide to my patient. So after some times, like I always like new challenges, or asking questions, exploring new things. So that makes me feel like the word of general physician is not very challenging for me. And I was also at the same time working at the university at a research center, and I found that it's more interesting to work with research because there is always new things and there is always something new to learn, and that things in the field is not the same as in the textbook or in and there are many things that need to be improved, and there's someone or we need more people to jump into this research field and help them improve their situation, because as we know that clinician is super busy. It's difficult for them to do clinical works and research at the same time. So probably it's a bit different with high income countries where doctors or they can share their works like 50% for research or 50% for clinics work, clinical works. It's not the case in Indonesia because we still have a very limited number of healthcare workers. So if you jump to clinical works and research work at the same time, it's very tiring. So, and then after that, I decided that I choose science or research and leave my clinical works behind. But I'm still working in tuberculosis, so somehow I'm still involved with clinical works.
That is inspiring.
Thank you both for sharing your very inspiring stories. And Dr. Lestari, from one general physician to the other, I definitely hear you about the limitations in certain healthcare settings with what you can do with a degree and trying to balance clinical work with research and other aspects of science. So speaking of research, research has shown that there's been an increase in the proportion of women authorship in recent decades. Nevertheless, women still comprise a minority of the authors of original research and guest editorials in many journals, especially the well-known peer-reviewed journals, and in these journals related to public health, medicine, and science. Men obviously predominate in these fields, and they often hold first and last author positions. Women are also significantly underrepresented as authors of single authored papers. So I would start with you, Dr. Asha. Having won many awards with research in Sri Lanka and worked even outside of Sri Lanka, what would you say the main challenges are with authorship issues for women in STEM?
uh, there are not special restrictions for women become an author for publication. The thing is, they have less time to devote for the writing work, writing proposals and writing research papers. So they always try to be a part of a team member, collaborate with number of men working as a scientist to tackle these issues. In that case, they underrepresent their ability to present as a single author in publication. In most of the cases, the proportion of being women scientists in a single author is less than 20% of publications. And most of the publications, women scientists play first or second authorships if they are in the collaborative team. And in spite of the fact that there are many women who have done exceedingly well in the scientific research, not many are seen in being awarded or rewarded or being seen in number of publications. This is due to the challenge they are having in their balancing their personal and scientific career life. So the authorship issues arise from that point. Otherwise, they have same kind of authorship rights as men scientists.
Thank you for highlighting those key issues, Dr. Asha. You had mentioned something about women not having time, and I guess it has to do with societal and cultural expectations of women and the burden of women within the society, thereby not allowing for time. So, Dr. Lestari, um, what do you think has been done to address these challenges of limited women authorship in STEM?
I think you're on mute, Dr. Lestari. You can just unmute.
Yeah, sorry. Yeah. So if you look at the number of publications from Indonesian researchers in PubMed, for example, you see out of 30 million plus publication or citation listed in PubMed, there's only like 30,000 something from Indonesia or related with Indonesia. And if you look at the affiliation, it's only like 19 or 14,000 or 15,000 from Indonesia. So it's like a general issue that we still have very limited scientific outputs from Indonesia, and there are also we also aware that a lot of research about Indonesia conducted by foreign researchers without involving local researchers. So that's also an issue here, and we already like the government just recently published a new policy related with research in Indonesia, which is that they have to involve local researchers. So that's a general issue. While for women, like the role of women or involvement of women in authorship, usually researchers are also an academician. So they're also an academic. They have academic works, and while we still have a very small proportion of healthcare workers and health scientists compared to the proportion in high income countries, so the load of academic work is also very high, especially for lecturers working in the university. So sometimes the challenges is probably not about their personal life, like handling family issue or household workload, something like that. It's more related with the academic works because there's not many researchers or there's not many academician in the university. I was in John Hopkins long time ago, and in one department in the door there's a lot of names only in one department, like 20 or 30 names in one department, while in my department, like I can see there's only like 5 or 6 people, and they have to handle like more than 50 or 60 students. So and so they have to give like a lot of lectures and student examination, etc. So a lot of academic works somehow also prevent them to put or focus on their time for research and then to write their research output. So probably that's the main issue.
Thank you, Dr. Lestari. And you do raise an interesting point that the disparity isn't just in gender, it's also in high income versus low income countries. And it's great to see that Indonesia has put out the policy. So, Dr. Asha, same thing over to you. What has the government of Sri Lanka or maybe academic institutions in Sri Lanka done to reduce the disparities in authorship or even women participation in STEM?
Actually, in Sri Lanka, most of the academics, they need to publish at least one single publications for the academic year. So it brings that you must do that in that sense. And also there is a separate allowances applicable for academics for doing research. In that sense, they encourage every academics to do research. But the thing is, even though they have done research and they successfully completed, when compared to the number of research done in the country, the number of research papers published are comparatively less. So, in order to tackle that problem, most academic institutions now practicing the initial rule I explained, giving some points when they apply for promotions or when they evaluate the academic norms covered by academic member at each institution. So the engagement of research is rising now in Sri Lanka, and we'll hope it will be ended up with good co-authored publications published by women scientists in near future.
And Dr. Asha, I want to go back to one of your points you said about the time and about the load, and also Dr. Lestari's point about the load of work that you have compared to maybe the Western researchers. So, what are some robust steps that academic institutions, the leadership in academia, need to be taking to address that kind of, because as we see, the workforce, with whether the women workforce itself, with women workforce being increasing in the recent decades, are we able to leverage that power of workforce to ensure that there is enough a proper career progression for every women faculty, and make sure that there's no disparities at the end of the day?
Yes, the thing is, in being an Asian country and having some cultural background, it creates social stigma of the women. Even though they are scientists,
Right.
some women are reluctant to present when men are there in large audience.
Correct.
So, as well as although working women, the scientists, handle their professional career facing a lot of competition and challenges at workplace, at home.
Sure.
They are one of the family member, but a special family member who is handling every household work, handle children and family take caring, cooking, social responsibilities. So all these things create the situation women scientists hang on the corner of the scientific world. In Sri Lanka, as a scientist working in neglected tropical diseases, I saw the 80% of women scientists working in this field work inside the lab, not in the field.
Right.
All this creates they are far behind the way they need to be. So I think balancing personal and professional life is the challenging task facing by the most of Sri Lankan women scientists. I think it's same as a lot of Asian countries, and the in country takes a lot of actions to educate young girls to pursue science-based careers for their higher education, and now they take a lot of actions to increase the intake of the university students, and there is an equal opportunity for men and women, but it seems girls are more like to do science and technology related subjects than past. So we hope this will work. This will resolve the problem of the lacking of women scientists in future.
Thank you for highlighting some of those key issues that talk about, again, larger societal expectations, norms. And you mentioned Asia. I know you've also worked in Brazil. So, just a quick question to you, Dr. Asha. Have you experienced the same challenges you just mentioned in Brazil as well?
The thing is quite different in Brazil. They have a more freedom than us, and when I worked there, I saw they have a lot of freedom to do scientific research, not like in Sri Lanka, because we have a challenge to go to field, and we have challenge to being with a group of men to do a research in field. So in Brazil, it was not there. And also, as I think they have not much concern about the cooking at home. They can go out and they have a more free time to relax with their families. But in Sri Lanka, it was lacking. So once we came home, we are not having at least relax when we are having at the workplace. So it's quite different. So always being a challenge in the Sri Lankan scientists, not like than the other counterpart countries. Yes, so challenging.
Thank you for highlighting that, Dr. Asha. So, Dr. Lestari, Dr. Asha had mentioned, just initiatives like women in STEM, gender parity in education, encouraging education of the girl child, as allowing for increased participation of women in science education, even from a fundamental level. Do you think these gains have been enough? And if no, what can be done to accelerate the gains?
Yeah, I agree with what Aisha has mentioned before, that we need to start from education level, like inviting students to our research instead of recruiting external person who are not as a research assistant who are not really have a background in STEM, but like introducing research to students, and then hopefully they can be interested to work as a researchers as in at the university or at research center. Maybe that could be a start. And second is in my settings, like we still have very limited researchers, limited number of researchers, and many researchers, they work on various topics. So the topics are very broad. So they are not focused on the topics. Usually the reason was because we don't have anyone else. When they have offer for this grant, the research grant, it it needs like a specific level of education, like they have to have a PhD level or professor level, so that many people do a lot of research on various topics. But actually, I mean, if they can like give the opportunity to young researchers who can work or mentoring these young researchers to work on this specific topic of research, and then like have a plan like this, like how many researchers we want to have in the next 5 years or 10 years. So if all research centers or university have a plan like that and open the opportunity to students, or like as an internship program, or I mean specific recruitment plan to increase number of researchers in our settings, probably that will be good, as well as and also we need to offer them like a salary pay, like a salary level for this level of assistant or intern. So this is something that's not common. I mean, we used to do internship in clinical setting, but not an internship in research setting. So probably if we can introduce a model like that, maybe we will have more researchers, young researchers particularly, who can be focused, and the senior researchers, they can also focus on their interests. So it's difficult to understand why people can, like, they can say their my research focus is infectious disease and non-communicable disease and communicable. It's difficult. I mean, it's two broad areas. I mean,
Yeah.
so maybe it's it can, yeah, it can like have a big heart and give the opportunity to others, maybe, and mentoring, and so play a role as a mentor and not the actor. Maybe that would be helpful.
And Dr. Lestari, you work with a lot of indigenous communities and rural women. So, I'm sure the challenges are unique,
Yeah.
but could you just elaborate on what are some specific challenges they face towards being part of mainstream science?
Yes. So Indonesia is very wide. I mean, um, for example, like if you can imagine, like the cost of flight, so a flight ticket from Jakarta, the capital, to Papua, it can be much more expensive than the flight ticket from Jakarta to Germany, for example. So it's much cheaper to fly to Netherlands or Germany than to fly to Papua. So first, it's the number of research in rural area is very limited because it's very expensive to the travel cost is very high. So that is that's a start. And then number of healthcare workers is also very limited in this rural area. So they are very busy with the patient, and because there's not enough healthcare workers, and the load is very high as well, because not many people want to work in the rural area. They prefer to work in Java, where everything is available, everything is easy to access. While in Papua, often you don't have internet access. It's the security is questionable. So first is I need a research assistant, and I'm trying to find a research assistant to work in Papua, and I didn't find it until now. So because they don't want to work in Papua, even though the pay is higher than if they work in Java, but because everything is easier in Java, then so that's the problem. But actually, for me, this COVID pandemic situation is like a blessing in disguise, because now everyone is connected. So I'm currently in Java, but it's easy for me to communicate with my research assistant or my colleagues in Papua through this Zoom platform or WhatsApp. So currently, like everyone now are familiar with Zoom, and we can have meetings. So I think this COVID-19 kind of provide the opportunity for them to learn from the expert in the central Java, so that they can also but the thing is how we can train them online effectively. So that's the question. Yeah.
Thank you, Dr. Lestari. And over to you, Dr. Asha. The same question, but maybe similar, slightly, I will change the question here. You have worked in northern parts of Sri Lanka, I believe, where there are lots of leishmaniasis cases due to, I believe, higher proportion of maybe sandfly population there. And the rural mostly women are hit harder than the men due to some of the responsibilities that you spoke about just now. And women are falling behind when it comes to education and other uh, progression into STEM careers. So what are some steps being taken there, whether it should be academic or non-profit or government, to propel the number of scientific workforce from those marginalized communities?
Actually, in this northern part of the country, especially I'm working in the north central province in Sri Lanka, and in here, the most of the women tend to be pushed out of the stable employment. So instead of being a scientist, they prefer to have a job in formal marginal economic activities, and most probably they are kind of attracted to self-employment or farming practices just because they can take care their family when they at home. So it will create the number of girls attend for higher education is less when compared to the central and the western part of the country. So in taking the government action, the thing is still this area considered as a rural area, and they are struggling to enhance their life in both economically and socially. So they are struggling to earn, and they are struggling to find water, sanitation facilities, and many more basic needs they need to carry out their day-to-day life. In that sense, the girls attend for higher education is less when compared to other parts of the country. So the actions taken by most of the women scientists in Sri Lanka is to promote science through the National Science Foundation. They have launched several programs to educate school children and promote scientific research among them, and with that they get together with the major government universities, academic institutions, and scientists to train these young school children who are at age 16 and 18 to train how to do scientific research in the lab environment as well as in the field. And they are going to encourage them to pursue science-based career in future. So this is one of the actions taken by the National Science Foundation in Sri Lanka. And other than that, the each part of the country, we are having reputed universities, academic institutions. So each university itself has their own agendas to cater the need of these school children, uh, to promote scientific research and to attract them to science-based career and technology-based career in future. So these are the few steps taken by the government as well as the academic institution in Sri Lanka. At the same time, sometimes we are creating some awareness programs and as well as some exhibitions specially planned for these school children to attack the science. So these are some initiatives taken at the moment.
Thank you. Well, the
Thank you, Dr.
future seems
Asha.
hopeful.
It's really great to hear about what the National Science Foundation is doing in Sri Lanka and in a lot of countries that you all have mentioned in the region. Dr. Lestari, earlier you had mentioned blessings in disguise of COVID, even though COVID has really just ravaged the globe as allowing for connectivity. I think one thing it has also done for women in STEM is it highlighted the hard work and successes of women who had been working in STEM and whose work and innovation were finally used in development of vaccines or other therapeutics that have helped combat or address the COVID pandemic. So I would ask you, starting with you, Dr. Lestari, and then you, Dr. Asha, what are you most proud of in your career so far in science or in STEM?
Um, for me, is to be able to help young researchers or young or local clinician or local health practitioners to do their works according to the guidelines. So like providing high quality of care. So assisting them, how can they provide care in high quality regardless of where they are. I mean, I'm very proud because I work in Papua, but and in tuberculosis program, and I can like we've been there for several years, and that now we can, I mean, we are in the rural area, but we can give examples of uh, good health practices, especially in tuberculosis control, that can be a lesson learned from for other part of Indonesia. So that is something that I'm proud of, and then that I can invite those nurses or doctors who previously not interested in research, but then now they have become interested in research and want to be involved in research. That's something that I'm proud of.
Thank you, Dr. Lestari. And before I ask you the same question, Dr. Asha, for anyone just joining us, on today's episode of Public Health in Real Life, we're talking about challenges faced by women in STEM or women in science in general. And we have two amazing women who work in science in Sri Lanka and Indonesia who have been sharing their experiences. So, Dr. Asha, what are you most proud of so far in your career in science?
Actually, I'm proud of being a scientist in challenging working environment in Sri Lanka. Uh, Not just because I started my career as an agriculture biologist and now ended up with controlling vector-borne diseases. So the path is not very attractive one, but I think the all challenges come through my way, and the all challenges I faced over the past 14 years has ended up, and now I'm working in a heaven where I can use my full potential to serve the poor, vulnerable people who suffered from these neglected tropical diseases in Sri Lanka. So I'm kind of having pleasure at last. I am now at the position where I want to be. So that is the most important thing in my life.
That's awesome, Dr. Asha. And going back to our topic about challenges faced by women scientists, what is maybe one primary advice you will give to a male who is in an academic leadership position, uh, maybe in an Asia context we can take, or maybe you can just talk about even Sri Lanka, that you would provide to increase recognition and whether it's authorship or career growth opportunities for women faculty. Dr. Asha, and then we'll go to Dr. Lestari.
Actually, if we can support to career growth of women scientists, even as a men, supporting the scientific and technological research and teaching and leadership activities, if they can promote more women scientists, that is the most
Right.
suitable action they could take for promote more women scientists in academic field, as not like women's struggling the balancing their career and personal life. So
Right.
the men's in the academic field can support at least balancing this, while
Yeah.
giving some advices and mentoring them and promoting them to do a individual research. So that is the most acceptable help we are seeking from men scientists in Sri Lanka.
Thank you, Dr. Asha. Dr. Lestari.
So, what advice should male leaders give? Like advice for a male leader, right? That's the
Correct.
question. Yeah. Should I say like do not underestimate the power of women, or the skills or capacity of women, and if they have issue in their works, don't blame it because they are women. So something like that, like look at them like equally, because I don't see there's a lot of difference in research between female and male researchers. I mean, we can do almost all of the things at the same level of competence. So if there's issue, don't blame it because they are women, so they can do this and that. But we need to look at the, like, of course, we as women we have a lot of limitation, especially with our role in society and in the family, that we have a maybe more role in the household. So but that is something that we can manage. So so just trust them and provide good mentoring for women researchers, or give the opportunity to women. I think it will be very beneficial for the institution or the organization to have more women in the organization.
Thank you both for that advice. And I think, Ashwin, is good to lean into allyship as a way where we can get men colleagues to support women in STEM. Before I start rounding up and ask the last question we have, I want to take this audience question. Indira Kadambi asks, for the road ahead, what kind of strategies might help to face or overcome the challenges? So I would want you, Dr. Asha, and then you, Dr. Lestari, to just answer quickly with one statement. For the road ahead, what kind of strategies might help to overcome the challenges? I know you all have mentioned a lot of that already. So starting with you, Dr. Asha.
Yeah. Were to promoting collaboration and communication among women scientists, this can enhance.
Perfect. Short and succinct. Thank you. How about you, Dr. Lestari?
Research mentorship. Yeah, so especially if you have international collaboration between high income, lower middle income countries. I mean, it's just not only on paper, but if the researchers in developed country can provide mentorship to researchers in low income country, that will be very helpful. So it's not only about money, but like how to improve their performance.
Sure.
Research mentorship is the key.
Perfect. Thank you both so much. And once again, thank you for your time. Thank you for sharing your experiences in research. We're really proud of all you have accomplished and your willingness and your candor to share the challenges you faced in your different fields, and even being open to what the government has done in each of your individual countries and what institutions have done. Lastly, before we leave, what advice would you give to any women watching or who might watch this at a later time and they are interested in STEM? So I'll start with you this time, Dr. Lestari. What advice would you give?
Perseverance, maybe. Yeah. So yeah, keep trying. I know it's difficult to do research in as a woman, but yeah, you just need to perseverance, work hard, and keep your mind open to every opportunity that come with you. And yeah, and keep the quality high or your standard high. Not because you're a woman, so you want to, uh, you can say that I can put the lower standard. No, but you must keep your standard high, so that people will respect you.
Thank you, Dr. Lestari. Dr. Asha?
I must say that in more socially conservative cultures with predefined gender roles, there's a lot of doubt about how successful in science career. So I must say, ignore these noises and approach new opportunities with courtesy. So one day you can be a big role model for other women scientists and other girls who would like to pursue science-based careers in Sri Lanka. So go ahead. This is not a race. This is a kind of a marathon. So slowly grow your career. Then one day you will be a place where you find your uh, lifelong happiness.
Great advice you both have shared, and definitely nuggets of wisdom you all have, shared with us in there. Lastly, one of the things we aim to achieve in this channel is to inspire the next generation of leaders. So, if anyone would want to reach out to you for mentorship, for collaboration, or support, what are your social media handles, and how can they connect with you? Starting with you, Dr. Lestari.
I can be easily contacted via email. I'm not good with LinkedIn. Aswin found me in LinkedIn, but I haven't updated my LinkedIn. But you can easily contact me by email. My email is my full name, trisasilestari@gmail.com.
Thank you, Dr. Lestari. Dr. Asha?
Yeah, I'm in Twitter, and also you can directly contact with while using my email address mentioned in the Rajarata University website, the departmental profile page. You can contact there. I have given all my contact details, including Twitter, LinkedIn, and Facebook.
Thank you, Dr. Asha. And for our audience also, if you've enjoyed today's episode, please feel free to like and subscribe to our channel. We're also on LinkedIn, Twitter, Facebook, Instagram. So please follow our handles for more content. We welcome feedback, we welcome support. And if you know of anyone working in a resource limited setting who is an unsung hero but is working hard on the field, please feel free to let us know, as we would love to highlight their work. Once again, Dr. Asha and Dr. Lestari, thank you for your time. Thank you for sharing your experience. It was a pleasure having you. Thank you for co-hosting, Ashwin. Everyone, please stay safe and be well, and hope to see you all next week. Bye.
Bye.
Bye. Thank you, Maimuna. Thank you, Auswin,
Thank